welcome to India Today, India Tomorrow, where we speak to families cutting across generations to get a sense of the changing India. And today we have two very special people once again joining us on India Today, India Tomorrow. Please welcome Dr. Pratap Reddy, the founder, chairman of the Apollo Group of Hospitals, and his daughter, Sangita Reddy, who's also very much part of the Apollo family handling healthcare at the hospital. Appreciate both of you joining us on the program. Dr. Reddy,
thank you, Rajdeep, first for the introduction.
No, it's a great pleasure having you because you, in a sense, represent what I would describe as the best of private healthcare. What you've achieved in private healthcare is quite remarkable. From one hospital, you're up to 64 and counting. Dr. Reddy, did you ever imagine when you set up your first hospital in Chennai in 1983 that all these years later you would have hospitals spread across the country? Was that part of your vision when you set up your first hospital?
I think my vision was then, as I said, when I lost that young man and seeing that his wife and children shattered, saying it should not happen to anybody else in the country. So it so happened that we started in a place where I was then resettled after coming back from abroad, Chennai. Then it came to Hyderabad, then we came to Delhi.
But tell us about the story about this young man. You said it was a young man who sparked off the idea to set up a private hospital. What is the story?
See, when I came, I'm a cardiologist. I was trained in one of the best centers in the world, Mass General, and was practicing there comfortably. But my father wrote a letter. He loved cars. So I used to send, whenever I buy a new car, put the children there and send. That day I sent the Ford Super Special car with the children. The reply came back. And so the agent writing, he wrote with his own hand saying, there are two people who like when your letter comes to read and feel happy. But if you can do something where people here, you can make them happy, how will that be? He didn't say come back. But my wife immediately suggested, I think it's right that we go back. And my children then was young, they couldn't protest.
And this young man was someone who had suffered a cardiac arrest in India and had to undergo a bypass, which at the time you said would cost what, $50,000?
In the US.
In the US.
He was having heart problem. We treat them with medicines. If the medicine did not act, surgery is just was developing in the world, and US took advantage, and they were the first to perfect it. And especially the few centers, Debeki and Coolies. And so I used to send my patients to them or to London to Dr. Donald Ross when they need, nothing can help them if they don't have surgery. Because we didn't have what we have today. The armamentarium today is tremendous with the cardiologists. They can open anything.
And
they can do marvels.
And you couldn't do that in the 1970s?
70s, even anywhere. But we couldn't do it in India.
And this young man passed away as a result.
He was given a date in October to go. But unfortunately, he couldn't raise $50,000 and he died.
And that death of that young man who couldn't afford to go abroad for that $50,000 surgery abroad convinced you that you had to build your own healthcare ecosystem for heart patients in India.
Yeah, that's, actually it's the wife and children. How many more families are going to be distressed like this because they can't raise $50,000 to go abroad? And why should they? Because I was in US and I think Indian doctors, including me, we were as good or even better. Patients prefer coming to us. Same with the scientists. And I went for Apollo 13 launch after 23 days. They had a party. My boss was the cardiologist for the NASA. When we went there, I saw so many Asian faces. And we asked one of the directors, they said, nearly 45 to 50% are Asians. In that, 90% are Indians. And you know, one of our Indian directors there gave me a type-in, which is both a transmitter and receiver. If that is the brains that we have, why shouldn't we use that here? Develop it here.
So that was the goal. How do you
Yeah.
develop that kind of quality healthcare, affordable quality healthcare? Because Sangita, one of the challenges that obviously anyone in the private healthcare has faced is make it affordable. It was one thing to have the vision that Dr. Reddy had, but to make private healthcare affordable. How much does a open heart surgery, which was $50,000 in the 1970s in the US, now cost in India?
So clearly, I think
At that
when
time,
we,
Yes.
at that time, I called the surgeons,
Yeah.
I called the anesthetists, and I called the CEO and the finance people. Together we put a price saying, let's make it $5,000.
So what was $50,000 in the US?
We started with $5,000.
We started with $5,000 in
with a
India.
clear verdict for all of them, saying, doctors and the team, that they must give the same results.
So it was about affordability. Is that still the challenge as it was then for Dr. Reddy as it is for you today, to make private healthcare affordable?
so tremendously, that's what we're trying to do every day. And I think by the power of this vision that we have to reach out to people, what was then $5,000, today we're able to give it an equivalent of $2,000 to $3,000. So at 1.2 lakhs, that's the lowest end of heart surgery, but we're doing large numbers of those. 3,000 we have for the middle income group, and then it goes up to 5,000 again for the deluxe
class.
rooms and the middle
See, and
class.
again,
But
this we should appreciate, that we have the capability of innovation.
Right.
because this is
We didn't-
35 years of inflation, but in healthcare it's gone reverse pricing, and that fact is little appreciated.
Yeah,
And-
because at the
and-
moment, as you know, private healthcare is under constant scrutiny.
Absolutely.
That you're
Yeah.
unaffordable. You are catering to a VVIP culture. What does an average person do? Is he provided the same kind of quality care that a VVIP would be provided in a private hospital? This is the constant criticism of private hospitals all these years later. It's something you've got to deal with.
And I think it's somewhere where we need to tell the story better, because the 5,000 rupee package was not only bringing down to 1/10 of the price and committing to innovation and quality, but it was creating an assured pricing package so that the ambiguity went out of it. Even in those days, $5,000 was a lot of money for many segments of the population. But the fact that you knew what you were doing, and there was a transparency in that package, and 1 in 10 patients would get very sick, and we probably spent $10,000 on them, but we didn't charge the patient. So we created the package deal system, which today many enlightened economies follow. Whether it's the US, they call it value-based care, they call it diagnosis-related groups, it's different names, but it's the same concept that he did 35 years ago.
I'll come to the private healthcare debate in a moment, but I want to personalize this and understand, where it all started. You were a young man in a small village in Chittoor,
Chittoor, yeah.
and what made you become a doctor? Did you come from a family of doctors, or were you the first in the family?
I think all this recognition I have today, I give it to my parents. There was no school, we had only up to 3rd standard in that village. So my father will get a teacher who taught us from 4 to 7, Ren and Martin, and 21 to 21, and broke our knuckles.
Really?
Right?
You said wrong things, you got it.
And how many
And
people
then
from
we-
your village in those days chose to become doctors? Or were you the first?
No, I was the first. I was the first and the graduate for the first time from the village.
First graduate.
And fascinatingly, you've actually gone back to your village, built there a 60-bed hospital, provided mobile vans. Living in that small village when you were growing up, did you ever imagine that you would be spearheading this large conglomeration of hospitals?
I didn't, but I gradually understood. I was as mischievous and naughty as any other child.
You were.
In school and college.
Were you a
But we
good
did
student? Were you a good student though? You
I
must
can-
have been to eventually go to the US as a cardiologist.
And I think I was both, you know.
So you were a mischievous student and a good student.
Every year in college, I had held a post, you know, something or the other, and involved in sport, involved in other activities, bringing people together and make things. But inside, saying our purpose is here to pass MBBS, become a doctor.
Why is it that Indians make such good doctors, Dr. Reddy? As you said, when you were in the US, you went to, you saw around you Indians excelling in medicine. What is it about the Indian doctor? Why are we so good at medicine?
I think, you know, world over, our brains are the same. It has got 750 billion neurons everywhere. I think it depends upon how much you focus. I'll divert a little. If you go to the spiritual people, they are also ordinary people. What they have learned is, they have learned to look within and find out how to use your power. I went once to Maharshi Yogi. You know, he was a big hit in all your televisions.
Yes.
In US, black and white televisions in 60s and 70s in US. I went to him when I was retired and living in Holland. And they told us at lunchtime, your interview is at 6. My second daughter was with me. 4:45, we went there, sharp 6, he walked in with his disciples. You know what time he left us? 1:45. And what is the message? Only one message. Learn the power of looking within. That will give you the power to do anything you honestly wish, and concentrate and focus and do it. I think this is where Indians, maybe the spirituality, you know.
Spirituality makes us, the inner force makes us better doctors.
But there's one other race whom I admire more, the Japanese.
Yes.
Because they are equally intelligent, but they are focused. I've seen them when you go. I went to one of the Japanese factories. They had put huge cutout of me receiving, and then I saw people when we were 2 batches of people. One put 3 ultrasounds a week. The other guys put 4 ultrasounds a week. The other people had a yellow band. I asked them, what is? They said they're on strike. So the people in strike there work more.
So even on strike, even while they were on
To
strike,
show what their potential
But the
is.
potential is.
I see.
And the second thing I was impressed is, not one person looked aside when their chairman as I was walking. Whereas in India, everybody wanted to know, curious.
So we could adapt the Indian way of life to the Japanese way of life.
Force.
Okay, but you know, Sangita, I'm told that you were planning to become a doctor,
Right.
and your father dissuaded you from becoming one.
Why
Why did you dissuade your daughter in the first place, and do you have any regrets? Do you have any regrets that he didn't make you a doctor?
I think after I got my medical seat and he didn't let me take it, I didn't talk to him for a month. But after that, I think he has enabled us to do more by working on a healthcare system. And I think in retrospect that he has the ability to gauge, you know, what's good for a person. And many years ago he told me, you won't be a good doctor, you'll take all your patients home, and therefore, while you may become a great doctor, you'll never have a life. And so
That's very unfair, Dr. Reddy. I mean, surely your daughter, if she wanted to become a doctor, you should have let her become one.
But now she didn't complete. That if as a doctor, they would have seen 100 patients at the most. Now they are managing 10,000 patients.
And so I now have no regrets,
So she-
because I'm able to impact millions of people.
No, so instead of a doctor, you became essentially a healthcare professional.
And a
You
support
became-
system
so you
for
became-
hundreds of doctors.
So you became more a manager of hospitals rather
Right,
than
and-
an actual doctor curing patients. But
Right.
so you have no regrets today.
Now no regrets.
Now no regrets, and
No.
you've ensured that all your 4 daughters are involved in the business
They're all involved
without making them
as a
doctors.
family, and took all other executives and all the sectors to become a family. So that's why we have done what we have done today, changing the healthcare, the world's best care to our people. And more than anything else, no other private hospital in the world have touched more than 160 million lives.
What was the most difficult challenge in those early years for you? Because we are talking about the late 70s, early 80s in this country. Private healthcare was a mirage. Nobody even knew what private healthcare was. So what was the biggest challenge for you when you were trying to go through the maze of the political bureaucratic system?
See, the first they said it's impossible. Only America can do, only England can do. I said, why are we having even all the, we are now independent country. Why are we still thinking of the past? That's over. Now, as Indians, we must say, Sir C.V. Raman, who created a zero. If zero was not there, the world would have been a zero. This is the thing I told politicians. I said, we can do this, and our doctors have done. NHS would collapse if Indian doctors come out, and even in US, large number of doctors do outstanding.
But it must have been socialist India, so importing, for example, medical equipment, they probably treated medical equipment as a luxury item at that time.
You know the duty? 360%.
360% duty you had on importing medical items. So,
and thanks to the Prime Minister and the...
who was the Prime Minister then? Indira Gandhi?
Indira Gandhi. And the Secretary, Rajbahadur Krishnaswamy, he was a private secretary. She told him, listen to Dr. Reddy and make it happen. So he listened to me and called the health secretary, Mr. who was Pondicherry, he was the governor of Goa and came back now to Delhi.
Right.
He was the health secretary. He called him and said, I want you to listen to Dr. Reddy and make it happen. It comes to the cabinet meeting this week.
And this was in Chennai?
Not in Delhi.
This was in Delhi. But when you wanted to set up a hospital in Chennai, which was your first big showpiece hospital, you had to deal with the late MGR, the Tamil Nadu Chief Minister. Was he welcoming or not?
He was not welcoming. He wrote that when the construction was going on, he wrote one line, and the hotel Kattadu Endam Nettu Endam. That means stop that hotel construction, not even hospital.
Hotel construction. He thought you were constructing a hotel. But eventually you treated the same MGR.
His brother first.
Saved his life.
And you saved his life. You know,
and afterwards he was very cooperative once the hospital started. And I think he understood the value. He saw that people who could have never survived or could have never afforded to go abroad were all getting treatment here.
You know, in a sense, therefore, when you look at his journey and look at those days, 70s, 80s, socialist India, 360% duty on importing medical equipment, the Chief Minister believing you're constructing a hotel, not a hospital. Does your respect for your father grow that he went through that struggle? Did you see him go through that struggle? Were you grown up enough to see your father rushing around trying to get all these permissions?
So we were very much part of it. We saw the struggle. We knew that in the evenings, he gave up his evening practice. So he'd be a doctor in the morning and a potential entrepreneur in the evening. And so you knew that every evening he may bring any number of guests home because they're working on the project and they realize it's 10 o'clock in the night and they're hungry. So mom has to feed any number of people. He told me once, I had a microbiology exam the next day. He said, come and help me write this press note. And I said, Dad, I have an exam. He said, if you study for 1 hour, you may get 3 marks extra. But if you help me with this press note, you'll help change the face of Indian healthcare.
So he was making you all do little things like press notes as well. One of your sisters was involved in the actual construction
And design.
So each of you were, this was like a family project.
It was totally a family project. But the story of our involvement, and that's just the kind of person he is, everyone becomes part of his team. I think I was 9 years old when I first worked for him, in that we did market survey, customer research. We went in and met all his patients and asked them how is the services, because he told us, don't waste your time at home, come and work in the clinic, tell me. And after the second day when we went back and tell him, Dad, they love you, they say you're so nice, you saved their life. He said, no, don't tell me all the good stuff. Because only if you tell me what they say bad, will we know what we can improve. And we finally actually came back and told him, everything looks pretty good, Dad, but your bathrooms are smelly. And so till today, it's now a culture of his and all of us that we check public toilets.
So are you saying every time you go to an Apollo hospital anywhere in the country, the first thing you do is go to the toilet?
Maybe
go to
not the first. He goes
did
to
the
emergency first.
I do public toilets, and I do the
Emergency.
patient toilets almost every day.
Almost every day.
Every day. And those days they used to count 21. When the first JCI turn came, they also did 21. So they told him out, 7, that's 21.
But tell me, in those early years, you were, as you were building the Apollo dream, in the day, as you said, you were a doctor.
Yeah.
And in the evenings, you became this entrepreneur. Then, was there ever a moment where you said, it's time to give up my medical practice, now I am a full-time entrepreneur? Did you see yourself eventually as a full-time entrepreneur, the Reddy genes coming to the fore?
What happened was, I said, now that it started taking shape, I had 6 doctors as my associates.
He had an internal medicine group practice in those days.
Medicine group
So
practice
his
of
team,
doctors.
so his team could do what he used
Slowly
to
I
do.
started giving them more and more.
Work.
And
then
training them.
One of them became Dr. Reddy. So he used to do practice in the evening for me. And weekends when I come to Delhi, he'll do the practice for me. And 6 months before Apollo started, I gave 90% of the work. I'll go in the morning for 2 hours, 8 to 10, then go off to the hospital site.
And funding, presumably funding this entire project must have been a huge challenge in those days. Money was not as accessible as it is today.
Not for me, for the Minister of Finance, Dr. Venkataraman.
Yes.
He told me, this is the first thing I must do for Apollo. Your file is on my table. I went second time. No, I couldn't get so far. I'll do it. Then again he referred it to IDBI. IDBI chairman wrote saying, it's a unique, highly viable project. I would like to do it. So he told me that's the 5th time. I'll get it done. When you come back to Madras, I'll give you the order. When I came to Madras, I saw him. He had a blank face. Sorry, Dr. Reddy, I believe it's not allowed. So when he went to defense, Pranab Mukherjee, our ex-president, he came in, and I saw 1, 2, 3 times. The final time he said, Dr. Malhotra was the
Secretary.
Mr. Malhotra was Secretary of Revenue or Finance. He came and he told him, if you don't do this for him, such a small thing, you are going to prove that I'm an inefficient finance minister. He said, what, sir, what, sir? He said, if you don't do it, the Prime Minister likes this concept of reversal of brain drain. And this concept she likes, so that our people don't have to go abroad for treatment. So he caught me by a hand, took us to the room, typed 4 lines, saying that you are
Commission granted.
Granted 50% by Indian banks, 50% foreign exchange loan for your equipment. I brought that, we started Madras. So 3 years later, that's only for Madras. Whatever they did,
Yes.
they did for Madras. 3 years later, we had another dynamic Prime Minister. So one day I wrote a letter to him. He called for me. He said, the way you read a letter. You know what the letter was? I wish I had done a BD factory or beer factory instead of healthcare. If health has to come along with your vision for 21st century, I need 3 things. 1, 2, 3. Number 1, hospitals should be funded like any other trade or industry. Number 2, health insurance and health plans should get tax exemption. And 3 was, if suppose you pay for somebody in India today for their health care, next year it was treated as income tax in their hand. I said that guy will get a second heart attack. So on he put 3 weeks there. On 18th day I got a call. PM is presenting your budget. I went there.
This is Rajiv Gandhi.
Rajiv Gandhi. I got a chit, and the chit is join me for, PM wants you to join him for lunch. I still don't know what he gave in the plate. But when I was saying thank you, what about the other 2 things you have written? Then he started for the insurance 1, 0, 0, 1,000. I kept quiet. Then they put another 10,000 saying exempt from tax. So that, I said, that's a great beginning. I'm sure, if
So
need goes
10,000 rupees was exempted from your tax if you
For-
put that money in healthcare at the
for
time.
healthcare insurance, if you buy
Health
insurance.
insurance.
Health insurance.
So this was Rajiv Gandhi in the
Rajiv
mid-1980s.
1980s. And
You know,
then,
it's a new word, yes.
I think
even
it's
in the insurance privatization, Malhotra became, he was asked to do the act,
Yes.
Insurance Act. So I had a number of meetings with him. So he said, let's finish health first. So health insurance would have come first. Unfortunately, at that time, the Congress was in government, opposition was BJP. So I went and convinced the Congress, I went and convinced BJP, saying it's good for people,
Yes.
we need this. So BJP agreed, the Congress agreed, but on the same day when it came for voting, nearly 1,000 people have come from various parts of the world who is interested in seeing when this happens to enter. Then Chidambaram was the finance minister. So he wanted to pass the bill, but unfortunately, the same day there was a meeting of AICC meeting in Calcutta. Majority of all the MPs have come to government. So he went to Vajpayee. He said, "Are you going to support this?" He said, "I'll support the act, not your government. I want the foreign doctors also invest, and if you can give FDI." Immediately he said it will be done. I don't know when it was done, but I was allowed FDI, 100% FDI into healthcare. So I went and had at least 25 meetings in US, 475 doctors invested from there. And then in London I had 100 meetings. They about 50 or 54 doctors
Units
invested.
of $5,000.
And
You're saying there are
10,000.
doctors who
Doctors-
invested as little as
In-
$5,000?
Not only that,
So breakfast in one house, lunch in another, small groups of doctors, and he's telling them that you're not coming back home, but find a way to help us change. And when you come in the holidays, come and share some knowledge. So it became such a beautiful model that there were 450 doctors who became a part of our brain trust. Leave alone their money,
Yeah.
they were giving inputs. Buy this equipment, do this, change this, create this protocol. It was more powerful than any
So
consulting
there was
company.
some notion of a reverse brain
Brain
drain taking place. Indian doctors living in the US, living in England, in some way investing back through the mechanism
Through this
in a sense
mechanism that he created.
that
It
you
was
had
new.
created.
I
Wonderful.
also did
And
something
20
in
odd of them came.
even in India. I showed this our audiovisual, and to at least 10,000, 5,000 to 7,000 doctors. There were 1,000 of them also invested 10,000 rupees.
So it's a
Because
collective enterprise.
I wanted
It
that.
was. It was
I want that
society's
essence
pride.
of doctor.
It's the essence of doctors, the sense that you are contributing to a wider community. in a
And
way.
even today, our shareholder base, they feel that Apollo is India's pride.
Today, Apollo and other private hospitals are under the scanner on the grounds that they have become profit-making factories, and therefore revenue maximization has taken over from welfare maximization. How would you respond to those who would make this criticism today of the private healthcare system?
So I think that it's extremely unfortunate when the contribution of most large hospitals or most, even the small hospitals, is significant in that we are doing high-end care at 1/10 of global prices. We're taking care into smaller district headquarters. Private doctors across the country are delivering what the public sector could not do. They are areas of problem, but I think the primary thing I would say is at Apollo, it is the welfare of the patient first, and we look at what we call and what we practice as an ideology of good profit. Because profit is essential to pay back shareholders who have invested and helped you create infrastructure, and profit is essential to reinvest into the system to grow more, because there is a tremendous shortage of infrastructure. So I'm very clear, and I think I'm sitting here today, but I represent not my family, my sisters, our senior leadership, 5,000 doctors, but 60,000 Apollo family members
all who follow the same philosophy of patient first.
So you don't put pressure on your doctors to set targets. There's been this entire debate that private hospital doctors are under pressure to set targets. This could lead to potential medical negligence. This could lead to overcharging of customers or patients.
I think
So
it's
all our
absolutely,
targets-
absolutely wrong.
Sorry?
All our targets to doctors are quality related targets. You have to,
They're not revenue related.
they're not revenue related targets.
What does it help him? If my doctor writes more tests, does he get anything more?
So no doctor in Apollo
No
gets
doctor.
anything.
So you
Yes,
judge your
okay.
doctors by the quality of the work
Quality
they
of work,
do?
that is. Only thing we review on them is the review on their
Outcomes,
outcomes.
the medical outcomes,
Medical outcomes.
and the NPS of the patient.
And what has he created new? Like, for example, nobody notices the innovation that we have done in healthcare to bring down the price. Like, for example, I use the same state-of-the-art MRI, and like, for example, in CT scan, I got a 640 slice CT scan. In overseas, they will charge, say, $3,000 for it. I charge 1,500 rupees.
You know, along
beating
with
heart.
this
It-
criticism
it-
comes the criticism that a VVIP gets a preferential treatment in an Apollo and in any private hospital. A dirt poor person will struggle to get a hospital bed. And that is the big difference between a government hospital and a private hospital in this country.
I think from day one we addressed this issue also, that India has a few rich people, a large segment of middle class and lower segment. So we have three types of rooms, general wards and rooms and a few deluxe rooms. The charges are in these three are different. $3,000 is for $3,000 or $4,000 is for the poor guy. Next guy pays $6,000. The deluxe room patient will pay more than $10,000 to cross subsidize. But the surgery is done in the same theater, same surgeon, same post-op, same.
In fact,
If
you
I
were
say
giving
in
me
heart surgery or 99% outcomes is on people.
you were giving me a good analogy earlier of a railway compartment. Give us that analogy.
So I think that the type of rooms we have is reflective of the demographics of the Indian population. So you have the general ward beds like the non-AC railway sleeper, and then you have the AC, and then you have maybe the coupe. But the important thing is everyone reaches their destination. So at Apollo, with the same theaters, the same doctors, the same equipment, the outcomes are the same irrespective of the room that you are in. And this philosophy or ideology has helped us to serve more and more people. And that's our basic core philosophy.
But the challenge perhaps obviously is the whole supply demand question in a country like India,
Which is huge.
where there are millions of people who need quality health care. We perhaps have all too few hospitals, and that gap as it widens, perhaps in access to to quality health care, perhaps makes the patient who can't get into a Apollo or doesn't, upset
and, yeah, angry.
This is a very
that-
crucial thing that the country is facing. Apart from the diseases we already had, we have this new thing called the non-communicable disease. We are almost the diabetic capital of the world, heart capital of the world, cancer capital of the world, infectious capital of the world, and people don't know. Young people are getting heart attacks. They don't know it's a heart attack. They don't believe it. But no, it's going to, according to World Economic Forum, it has started showing its head on 1st January 2015. By 2020, he says it will be ugly. By
Tsunami.
2030, it will be terrible.
2020 will have a tsunami.
Tsunami.
And that tsunami cost is going to be $30 trillion for the world. For India, it's going to be $5 trillion,
This is
which
the
is going to be
cost of non-communicable diseases
Diseases.
and treating them.
they're treating them.
So this
And-
whole,
And
so
I
this
just
whole
wanna
question of
say-
health
That
for
is,
all.
yeah.
How is that going to happen? How are we going to then achieve this notion of health for all?
We
So-
can, I think, if you all work together, if the public-private partnership, people partnership comes, all the four diseases can be changed. If a person goes and finds out if he has any risk for heart disease, and you remove the risk, he won't get heart attack at 30, he probably will get it at 70 and still live.
But we have a shortage of doctors, shortage of hospitals. How are we going to overcome that at the moment?
So I think this vision of health for all is a very important one. First, we must believe in the fact that every Indian deserves good health care. At the first tier is to create the infrastructure, that's more beds, almost 80,000 beds a year required, to add, double our doctors, treble our nurses, and grow by 4 times the number of paramedics. This sector must grow in the public and the private. At the next year, we need to find affordability and access to this, because what is happening is that even this 1.5 lakhs for bypass surgery, which is 1/10 or 1/15 of global price, is too expensive for a school teacher, for a policeman. So what we need to do is create a universal health coverage with differential payments so that everyone has a passport to healthcare.
That differential is important. They're talking about universal health care. I don't see why a person who is living in a comfortable home should get free health insurance. Man
So
in the heart,
after
that
we
30%
tier,
Yes.
needed.
after we tier the premium payments and ensure that everybody is cared for, the next and a very, very crucial step is preventive healthcare. So we need national screening so we pick up the signs early. In an Indian hospital, one of the most painful things for us as administrators is we see our heart disease patients with 5 and 6 blocks. Where were they when they had only one vessel blocked? We see our cancer patients in stage 3 and stage 4. If we picked it up at stage 1, we could treat it less painfully and cost effectively.
Sure, but part of that also would involve private hospitals going perhaps beyond the big cities to the district capitals, to tier 2 towns, to tier 3 towns, to a Gorakhpur which suffers every year from encephalitis.
Which we are ready to do.
You are ready to do, you are ready to go beyond the big
We've screened
cities.
patients from Ajmer to Aragonda. We've done diabetes screening, hypertension screening, cancer screening. We've set up hospitals and district headquarters. We do telemedicine to some of the remotest places in this country. We will do it in PPP model. We will create innovative access models. Let us find a way to work together, because PPP
That's
is
the
not
most
just
important.
about public and private. PPP actually is about the people, and it's about blurring the lines and not differentiating between a public or a private. The only question government should ask is, do you have quality? Have you been good?
Because we are in the age of telemedicine. We are in the age
Exactly.
of, this is a country which is
Everything, yeah.
not just has medical expertise but also technology expertise. We need to harness that. Why can't someone in the northeast or living deep in Jammu and Kashmir or the Himalayas
Which
get
is
the access to the best
exactly-
facilities of a Chennai or a Hyderabad or a Delhi?
Which is
No, no,
exactly what
yeah.
we're doing. In the remotest areas of Northeast, you teleconsult with our doctors sitting in a central medical call center. In Jammu, we have, and in Srinagar, we have similar things attached to small doctors' private practice. So if they don't know how to do it, they can ask us. 60,000 common service centers of the government. In the government hospital in Khaza and Kailong, inaccessible 3 months of the year, in the government facility, we run the emergency room out of our emergency room in Chennai.
A great believer that technology can overcome many of these barriers when it comes to access to quality healthcare.
It will do 2 things. First, it will be able to give contact for people, but more importantly is, even for a common doctor, this artificial intelligence will tell exactly how we can manage critical situations.
So in a
So
sense,
we
the
are
challenge
now in
of
a-
our times is to harness technology and new techniques to be able to then
Create new age medicine which is accessible and affordable to all, where a fresh
scale it
doctor,
up.
a fresh doctor can have the skill set and the expertise of a 20-year-old specialist, someone who's practiced for 20 years using AI and using data. So we build those algorithms and make them accessible to physicians at all levels. We put knowledge into the hands of the ASHA workers using tablets. We partner to do disease mapping so preventive health care. Year after year, dengue comes in same time and has the same toll on population. Why aren't we doing heat map of disease? So these are the type of dialogues which actually we are today having with the government, with the health ministry, with Niti Aayog, and I'm thinking that this is something which is going to be there for India. So when you're talking about an India tomorrow, these are definitely tools, techniques, capabilities which not only will India use, public and private, to transform Indian healthcare, but I hope that the solutions made in India can help transform healthcare access all over the world.
So in a sense, you
For-
need many more
for-
Apollos.
for-
You need many more Apollos spreading across this country, not just with the Apollo brand, but other brands emerging also,
yeah.
and
Absolutely.
creating, and with many more doctors. We have a huge shortage of doctors in the first
Yes,
place.
yes.
Oncologists, for example, you refer to,
yes.
to cancer, which is becoming a killer in different parts. So, are you positive, therefore, looking at the future? Are you someone who always sees the glass as half full, Dr. Reddy, in life?
I strongly believe people must realize that when they are occupying a seat, they must, when they feel happy when they leave it. So I'm very happy our health minister finally is going through the screening program. 500 million people, if they're screened, it's going to make a huge impact for that 500, but automatically all others. My only this one is, it should be a must before an adult turns into.
But would you agree that the entire private medical system also needs to look inwards, see the gains that you've made, and ensure that you're as transparent, particularly in your procedures? That when I come to a private medical hospital, in terms of being charged, in terms of how I'm treated, the system becomes more transparent, so that no one turns around tomorrow and says, oh, there was negligence, because patients' families otherwise will turn and always blame the hospital for medical negligence. Do private hospitals also need to look inwards? Do you need to introspect?
It's a must. What's called Apollo's all credibility is because of our process protocols. You know, there's a thing like in the theater, half an hour before they give an antibiotic shot to take off any infection he already has. But our protocols are so but to keep it infection free. So no antibiotic after the surgery.
But if I may add, so the process that Dr. Reddy was referring to, Apollo Clinical Excellence, is a methodology of tracking and putting these protocols in place. But I must say that every system, so when you keep on checking, you keep on looking at it, you will find and you will improve. And that's a continuous process. But for public, and I say this, quite significant, I think that a country is significant with the courage of the questions which are asked and the depth of the answers. So when we raise important issues like access to healthcare, like negligence, let us also enable the depth of the answer and understand what needs to be corrected, how should it be corrected, how can we improve the system, because what is important is that healthcare providers and doctors want to help patients, want to treat patients. If you constrain the infrastructure, you will have a squeeze either on quality or on ethics.
So if I
this is what I'm saying.
So if I put the question that the young doctors of today lack the compassion, lack the vision, lack the commitment to the profession, are treating it like just another business, am I wrong?
I would
am
say
I unfair to them?
There
Am
may
I
be
not showing that depth?
very few people, and if it
generalize.
happens, it will be people who are not given that direction.
So you don't
Otherwise,
see
if he
this
has done
definition
the
of the
medicine-
doctor as mercenary is unfair to the doctor.
Very unfair.
Okay, let's
See, to be
Because
Yes.
in every place there is one black sheep. But you
Don't
can't make
tar
that
the entire
generalized.
profession is
I'll
what
give
you're
you, on this
And
process protocol, I'll give you one example. One country had a virus called the Merck virus. People in intensive care, doctors and nurses were dying. They called for our team. Then we sent a team for establishing this. In 7 days, they put the process protocols in the ICU. No deaths from that day. This is the power. If Apollo or good hospitals in India are giving this care equivalent to the best centers in the world, because we have developed this process protocol relevant to our people.
to be fair to the suffering of patients who have, in some environments, had a problem, I will say that there are things to be corrected, but I will also say that at Apollo we are 100% with the patient, for the patient, and I think that philosophy exists in many, many institutions.
Let me ask you then in conclusion, 4 daughters all in the healthcare sector. What do you all talk at the dinner table? Is it about healthcare? Do you talk about protocols, process protocols? Or do you talk about the weather and other nicer things of life?
We take how we can make people healthier and happier.
Now the next generation has come in with a huge focus on wellness. So we talk about acute disease, heart transplants, but also talk about how to keep people healthy and well.
And it's all in the family, I'm told, because finally out of your 10 grandchildren, your youngest son is going to become a doctor. So you're going to have another generation of Reddys.
I'm so happy.
You managed to finally convince one
He
grandchild.
went round with me to 5 hospitals.
Right.
And finally said, Grandpa, I'm ready. I will join the medicine.
But let me also share one last story, that on the day we inaugurated Apollo Chennai, 1983, September 18th, that evening we were sitting there and Shobna actually told Dad, this is a big day for our family. And he said, yes, it's a big day, but from today our family is no longer just 4 of you. Everyone who works at Apollo is our family.
Yes.
And today we have 70,000 Apollo family members and we're still growing. By God's grace, they share the vision and the passion.
Well, I think
That
the
is
word
it,
passion
that's
is what
what
defines you.
yes,
Every time I
yes.
see you, Dr. Reddy, at the age of 85, you have the passion of an 18-year-old. You've got to tell me the secret to that one day. What's the secret, at 85 to having the energy of an 18-year-old?
The secret is that you can give happiness and health to people.
Okay, so if you can give happiness and health to people, then you can remain 18 till I die, as they've said in that song.
Yes.
Well, that's the way to be, Dr. Reddy. Thank you very much for joining us. Both of you have been wonderful in this special edition of India Today, India Tomorrow. Dr. Pratap Reddy.
You are very special in bringing this message to people.
Thank you very much for joining me on India Today, India Tomorrow. Sangita Reddy, Dr. Pratap Reddy. We'll be back for another episode. Thanks for watching.
Thanks for watching the video. For more such news and updates, please like, share and subscribe to India Today. Also check out our other great videos from our channel. We know you would love to.